Hello, this is Dr. Stanley Lang. Welcome to this video broadcast, and the subject is natural ways to lower blood pressure. And the reason I'd like to share this subject today is because I actually saw 3 patients in different stages of the answer to this question today, and I thought it would be kind of useful to revisit some of the things we've talked about in the past. And the basic concept that I want to talk about first is a whole person health approach to wellness and disease prevention and health recovery once you've got a condition. So this means that bringing to the table physical, emotional, and spiritual resources are the 3 main areas that we have that help us to recover from illness and help us to stay well and to prevent illness. And so the things I want to share about this natural ways to reverse blood pressure or to lower blood pressure is in the context of that whole person health strategy, although I'm going to be focusing primarily on a couple of physical strategies today. So the first concept that I think is the most critical in the physical realm is to choose to eat low glycemic. Now, there's no question that diet is foundational, but a lot of people simply focus on a couple of things in the diet, like salt, and a lot of people inappropriately focus on fats without aiming at the idea that you want to eliminate bad fats without cutting out the good fats. But most people are missing the main factor when it comes to the dietary strategy that helps to reverse blood pressure, and that is eating in a low glycemic way. So low glycemic means that we eat in a way that the blood sugar does not rise rapidly after any kind of a meal or a snack. If the blood sugar rises rapidly, that's a high glycemic meal, and some components of that meal or snack are high glycemic, meaning that they are broken down to sugar quickly and it raises the blood sugar quickly. When that happens, that aggravates the underlying blood pressure problem. So the vast majority of people who have high blood pressure in our country have metabolic syndrome or insulin resistance syndrome. And over many years, their body has become resistant to their own insulin signal. And so when the insulin level gets high enough, it starts to tell the blood pressure to go up. And so it does. And for those individuals, they have 2 alternatives: reverse the insulin resistance through a variety of lifestyle strategies, or take 1 to 3 medications for the rest of your life just to control the blood pressure, not counting statins for cholesterol. And for a lot of these folks, they go on to develop diabetes because of the same insulin resistance issue. So a lot of these folks are on 5 or even 6 medications, or they could have followed a lifestyle strategy and reversed the blood pressure issue in the first place simply by eating in a low glycemic fashion as a foundation. And then there are other strategies within this whole person health approach that also work together to lower the blood pressure. So the first patient I want to tell you about has been following the program that I'm referring to since February of this year, which is about 6 months or so. And this person started out with blood pressure that would be considered stage 2 or moderate hypertension. So we're not talking about just mild. She was in a range where, if you don't treat it, risk of stroke is substantial, risk of heart attack is substantial. But simply by following the strategies that I outline in the dietary principles of this whole person health approach, her blood pressure now is 128/70 on no medications. And this is a person who's in her upper 60s. So this isn't some young person who can kind of bounce back from only a few years of bad chemistry. This is a person who had been living life in a way to aggravate the underlying chemistry for many decades, yet this was completely reversible by following the right lifestyle. The second person I want to tell you about is somebody who's kind of right in the middle. She has been having significant blood pressure problems for many years. She thought she was going to have a stroke a couple years ago, and she's been on medication ever since then. And I've given some dietary strategy advice and other non-dietary strategies in the emotional and spiritual realm of stress reduction. And some of it's helped, but not really made a big impact until in the last 3 months, this patient turned the corner and decided to seriously follow some of the dietary principles that I outlined. And she is now at a place where she can stop her blood pressure medicine. She hasn't stopped it yet, but her pressure is low enough to now give it a try because she's down in the 120/70 range. And when she stops that one blood pressure medicine that she's still taking, her pressure is going to rise a little bit, but it's not going to rise up into the above 90 range. She's going to be fine. And as she continues this strategy, she's going to be off of her blood pressure medicine simply by following lifestyle strategies that she's been aware of, but for whatever reason had not chosen to follow until recently. And now she's following it, and it's become very easy for her at this point. First few weeks is always a bit of a challenge for anybody. Now, the third person I want to tell you about is somebody that I saw recently who thought she was at risk of a stroke. She thought she was having some symptoms that were warnings of a stroke. In fact, they weren't. They were being caused by stress. But her blood pressure was high at home, in the moderate blood pressure range or stage 2 blood pressure range. But she came to our office today. It was mildly elevated. And she's just at the point where she could easily reverse everything she's doing just by the lifestyle strategies that we've talked about. Physical strategies, emotional, spiritual strategies, especially low glycemic eating. And the low glycemic eating is the foundation of the natural ways of lowering the blood pressure. It's the single most important thing that you must do if you're going to lower your blood pressure naturally, because it's the foundation, it's the cornerstone of the abnormal chemistry that is keeping the blood pressure up and telling the body to raise the blood pressure. And so this person is just embarking on the journey today. Now, within 3 months, this person's blood pressure is going to be a lot lower if she stays on the journey. Some people do, some people don't. You're in a position where you can decide, are you going to start the journey or not? Now, if you're interested in starting the journey, I have a free book that I'd like to give you. And you can get that book by clicking on the link below this video or beside the video or maybe on the video, depending on where you're seeing this video. And just start reading that book, that ebook, and it will outline for you the exact same principle that first person I told you about in her upper 60s completely reversed everything, reversed her diabetes, reversed her blood pressure, and on no medication for that stuff now. And you can move in that same direction and achieve similar results most of the time. Now, I don't know your specifics, so I can't promise for sure that you won't need medication, but you can definitely move in the direction of less medication, and the chances are good that if you're only on one medicine now, the chances are very good that you could be off of that medicine within a few months if you followed this program. Now, I never recommend that you stop medication without talking to your doctor, but I'm just trying to tell you that when you're following the strategy, it puts you in a position where you will not need the medication anymore because you fixed the underlying chemistry. So I hope you found this to be helpful, and I offer it as an encouragement that you can make a difference. You're just not a victim to things happening to you, but you got to make a difference in your lifestyle choices. God bless and have a great day.